And the title of our webishop this morning is Tufunga Ola. And it's about how effective Pacific leadership will ensure that Pacific well-being in times of great challenges are addressed appropriately and effectively and adequately. In public health and health promotion, leadership is essential because leadership will lead to effective public health policies, fair distribution of resources and power for the final outcome of the holistic well-being of everyone, and no one is left behind. And that goes to all of us fellow human beings and other beings, and of course, the well-being of the Fonua, Mother Earth. And that's what Fonua is about. Fonua is a Pacific concept, and deeply culturally it means the dynamic relationship between humanity and all other beings and the well-being of the Fonua, Mother Earth. And Tufunga Fonua is a form of Pacific leadership where not only that we address the well-being of humanity, but also the well-being of our one common home, planet Earth. The most significant issue and challenge for the world today. And here in Aotearoa, we face all sorts of challenges that come from the global level and also from the national level. Geopolitics, ineffective economic systems, pandemics, NCDs, environment, so on and so forth. And so the idea of the workshop for this morning is to draw on the experience of Pacific leaders in the health space and other spaces to explore how good governance and leadership, how nation building and community building, or Tufunga Fonua, can be tools that we learn from the experience of these leaders to help us navigate towards well-being in times of troubles like what we are experiencing not only in Aotearoa, but also at the global level. So our format this morning, as the facilitator, I'm Sione Tuitahi. I will introduce each of our guest speakers, and then they will speak. Sir Collin Tukuitonga will be our first speaker, and then to be followed by Dr. Aumea, Herman, and last but not least, Fiongalu David Funaki. And after that, there will be questions and answers. So the speakers will take up to 20 minutes each. They might or might not have slides to share with us. But after their three addresses, we will have question and answers. So feel free to utilize the chat box and ask your questions. Do not shy, be set back. Please use this opportunity to ask questions that are central to your thinking and to your minds and heart. So we have 1.5 hours to be together. So without further ado, it's my honor to welcome the first of our three speakers, Sir Collin Tukuitonga. Sir Collin is a Niuean public health medicine specialist, and he is currently an associate dean, the associate dean Pacific at the University of Auckland, Faculty of Medicine and Health Sciences. Collin is also the co-director for the University of Auckland Research Center for Pacific and Global Health, Te Potoko Ora Akiwa. He is also associate professor of public health at the university. And Collin is a career public servant with extensive experience, not only in New Zealand and the Pacific, but also internationally. And my pleasure to welcome Sir Collin. The floor is yours, Collin. Thank you.
Maloelelei Sione Kia rana, everyone. Whalawhalahi atu, Nisam Bulavinaka, Talawhalawa. Whalawhalahi atu, and thank you, Sione, for that generous introduction. I don't have any slides. I think you can Google leadership styles yourself just as well as I can. What I thought I might do is to just share with you my experiences. As many of you would know, I'm not a spring chicken. I belong with the dinosaurs, my kids tell me. And my grandkids in particular take great delight in telling their friends that our granddad is a dinosaur. But you know, you don't become a dinosaur without learning a few things. So I thought I would share that with you. How effective is leadership in times of trouble? I was intrigued by this topic. And, you know, the thing that comes to mind for me is that's why you need pilots on a plane. That's why you need captains on a ship. When things are happening and things are going well, it's questionable whether you need leadership. People pretty much know what their roles are and what their contribution is to one another. But when there are challenges, when there are difficulties, that's when you need good, strong, ethical leadership. In my view, leadership, in my view, is about doing the right things at the right time for the right reasons. We've all learned about so-called leaders over the history of humankind who are not leaders because they're there for the wrong reasons. Hitler, for example, Hitler is not a leader in one sense, but of course he's probably one of the standout leaders in history for the wrong reasons. And that's why I say leadership is about doing the right things. And some of you will have heard me speak before about this. Management is about compliance and doing things right. And I think one of the problems in the health sector at the moment is we've got too many managers and not enough leaders. The second thing I'd say about leadership is about values. About values. Standing up for the right things at the right time is what leadership is about. And so we need people who can stand up and speak out when things are not going in the right direction. And it's arguable that we have a political environment at the moment represented by the three political parties for their own reasons. And, you know, when the so-called political leaders attack te reo and te ao Māori, that's not leadership, in my view. Te reo Māori, te ao Māori, is unique to Aotearoa. It's what sets us apart. And leaders, true leaders, should protect and promote te reo Māori, te ao Māori, to build us a nation that reflects ourselves. So I give you those as examples of what I consider leadership to be. So in my view, good, strong, ethical leadership is doing the right things, promoting the right values of integrity, of trust, of shared values, of looking out for one another. You see, leadership in a commercial sense, in a neoliberal political sense, is often attributed to usually a bloke sitting on the top of the tree, holding court with everyone else. That might be a form of leadership, but in my view, that's not leadership. That's power tripping over everyone else. Leadership, in our sense, is about shared values, community values, working for the good of others, sharing our humanity. That's my definition of leadership. Sometimes called adaptive leadership. We're all called upon to lead depending on the circumstances. Leadership is not about vesting power in one individual over everything else. We all have a duty to lead, to contribute, to share our strengths with one another, to build and to support emerging young people, to help us achieve what it is that we set out. So in a sense, it's arguable right at the minute the political environment in our country is not my idea of leadership as such. And this is important because, in a sense, it sets the tone for a whole lot of other things. And I spoke last week at the post-budget session in Wellington on what I think needs to happen. So I'm a great fan of, we have our own sort of traditional forms of leadership. Some inherited, some not. But one of the things that transcends us all, and here I'm talking about Pacific communities, is the notion of servant leadership. You lead by serving. You don't lead by power tripping over other people. So leadership is facilitating a journey for us all in a particular direction. So how effective or how important is leadership when there are challenges? I would say to you that even more important when we are faced with challenges, that we speak up, we stand up, we articulate the values that are important to us, particularly Polynesian people, and here I'm including Māori and Pacific folk, where we have communal values, we have shared values. It's not about amassing wealth for the individual. It's not about amassing power for one person. It's about using your talents, your skills, your opportunities, your resources to benefit others. I've been accused of being a lefty, and probably right, but you learn from an early day in the village on the rock that it's not about yourself. It's about your community. It's about us all. Re-emphasized and strengthened by being raised in the Catholic Church, whether you agree with that or not. One of the big things about Catholicism is the emphasis on social justice, fairness, and social justice. And as it happens, I chose a career in the health sector and public health. Public health is about the greater good, which is the work you do in health promotion and disease prevention, but it's also about social justice and leadership that encourages and promotes social justice is, in my view, what we should be striving for, particularly when there's challenges of plenty. So good topic, Sione. They are my reflections and thoughts that I share with you. Some of you in the audience, of course, wouldn't agree with me, and that's good. And happy to have that conversation when the time comes. But they are, for what it's worth, my reflections on leadership when we are challenged as a community. Venaka Makalevu Sione, and happy to listen in and respond to questions when the time comes. Thank you very much.
Thank you, Sir Collin, for those gems of wisdom from your decades of leadership and experience across not just the health sector, but many sectors at all three levels of national, regional, and international. Certainly the participants will not only treasure, but they will ponder and ask questions. And as Lavinia on the chat is encouraging you, please do reflect and ask questions. This is the opportunity to ask questions after our three speakers speak. Our next speaker is Dr. Josephine Aumea Herman. He is of Cook Islands. She is of, Cook Islands descent, a public health physician, epidemiologist, and also a general practitioner. Currently, Aumea is the Chief Clinical Advisor, Pacific, at Health Manatū, Hauora, New Zealand, Ministry of Health. She is the former Director of Pacific Health at Waitemata District Health Board, and prior to that, she was Secretary for the Te Maraiora Cook Islands Ministry of Health, as well as a Medical Officer of Health at the Auckland Regional Public Health Service. Welcome, Aumea. It's an honor to have you. And again, thank you for accepting to speak at this webinar and panel. The floor is yours.
Thank you very much. Kia ora, everyone. Lovely to be here today, and always difficult going on after Sir Collin has spoken, but I'll try my best. I have some slides, and there's quite a few, and I don't have much time, so we'll just wait for it to load up. If Emma.
Be there just
Aumea, you can load.
Should I share from me?
Yes.
You can share, so you can be in charge.
I'm not sure if this gives me...
I've given you permission.
Share. Okay, here we are.
Fantastic.
Hold on. Is it sharing?
It is.
Can you see the civic governance slide?
We can.
Yes, we can.
Okay. Here we go. There we are. Excellent. So I think sometimes it's good to remind ourselves about where we've come from in terms of the 22 Pacific Island countries and territories, all sovereign states. Some are territories of larger nations, and excuse me. And I think in terms of this particular talk, I wanted to focus on how we need to remember the past to understand why and where we've landed and what we need to do to get better health outcomes for our people
was all drafted for us. So I feel like
so in terms of Pacific governance and leadership, the first one I wanted to draw our attention to is back in 1995, where we had the first inaugural Pacific Health Ministers meeting, and this was held in Fiji. And through this conference, we had the Healthy Islands strategy developed, and this has held well for the Pacific Island countries. And why I reference this is because I think there's opportunities for us to think about our homelands, our respective homelands, as well as what we do here in New Zealand. And one of the things that has happened over time has been the appointment to a very high sitting leadership position in the Western Pacific region. This is with Dr. Saya Piukala, who is a Tongan surgeon who was working who was a Minister of Health in Tonga, and stood up for the elections for the regional director position in Wipro. And as you know, Wipro looks after New Zealand as well as the Pacific Island countries in some parts of Asia, China, Japan, Korea, etc. So it's been a huge achievement for Pacific in terms of leadership. And if we come back here to the New Zealand health system, there has been work that has helped connect some of our Polynesian countries in particular to the New Zealand health system here. And this kicked off in 2019, where we had the first Polynesian Health Dialogue. And this program continues. Some of you might have heard about the new funding that has been approved for this program, and it continues to support the 3 round countries of New Zealand, Niue, Cook Islands, Tokelau, as well as Samoa, Tonga, and Tuvalu. And I suppose this is an important reminder of our connectedness and our ability as Pacific leaders across the country, because you'll see many of us in these photos here work between systems, not just in New Zealand, but also in the Pacific Island countries. So you see Alec Ikaroma in the back here. I'm trying to show him with the mouse. He's now currently the Director General for Samoa Ministry of Health. There are many others that are here as well. The previous, one of our previous leaders, Dr. Joe Williams as well. So this, I thought, would be good just to remind us of some of the things that have happened in the past, more recent past. Currently in the Pacific Health, in the New Zealand health system, this really is a graph, a picture showing where some of our Pacific leadership is sitting right now in the Pacific, in the New Zealand health system. We know Fepulia e Maji Apa looks after Te Whatuora, our delivery arm. And then, of course, we've got our Pacific Directorate led by Makrita. And then, of course, in the National Public Health Service, our Director, Pacific Public Health, Api. Now, on the other arm, the Ministry of Health, where I work currently, the policy arm, stewardship arm, we've got our Director, Pacific Health, who I report to, Tangaloa. And what I wanted to demonstrate here really is looking at some of the leadership structures and governance mechanisms that are in place to support our people. And you've got the Pacific Expert Advisory Group, which has many of our Pacific leaders, Debbie Sorensen, Debbie Ryan, Api Tale, Maitonga, sitting here and advising the Minister of Health. We also have a National Pacific Health Senate, which is chaired by Dr. Kiki Mawate, who that provides support to Makarita. And I suppose just coming to myself in terms of my academic path, because I find that throughout life, Sir Collin referred to this, we learn a lot along the way. I do feel old when I talk about this, but I think through experience, we're able to help inform the work that's happening now. And also with our emerging leaders that are coming through the system. So I started with ONG and realized that prevention might be a better place for me because of the need of the understanding that health promotion, health prevention and health protection was probably a much more important aspect for our people to keep us more in the healthier health and well-being state rather than being in illness. So I did my public health career and also a PhD in road traffic injuries, which focused on driver sleepiness in Fiji. And that was actually really interesting. We know that road traffic injuries in the Pacific are quite a problem. We lose a lot of our young people in particular through this. And of course, I continued to sort of stay in the clinical space and did some GP training as well. In terms of places of work, I've worked in the Pacific region, especially in the Cook Islands, as a public health director and clinical director. And it's through this process I was able to apply some of my training in terms of engaging with the people, but covering all the big ticket items around health protection. At the time, we had the dengue outbreak, as well as measles. No, not measles. It was the dengue outbreak in particular. And at that time, I think we had the big threat that came through with SARS. And at that time, Sir Collin was looking after Director Public Health in New Zealand and helped New Zealand respond very effectively. I've worked in Australia in the Office of Aboriginal and Torres Strait Islander Health, and it was an important learning for me, or experience for me, because it demonstrated the differences between health systems, where in the Pacific we are poorly resourced compared to New Zealand, which is actually, in my view, poorly resourced compared to Australia. And it makes a difference in terms of what you can do, but it also teaches you, coming from limited resources settings, the value of using your money and trying to stretch that dollar as far as it can go in the most efficient manner. In the Auckland Regional Public Health Service, I went straight into a job, and soon after we had the mumps outbreak in 2017 to deal with, and I was the measles, mumps, rubella portfolio lead. And interestingly, this was a time when we realized that there was a large number of Pacific people, young Pacific teenagers that were not vaccinated. There were discussions around preparing the MMR vaccination campaign. This did not happen. And then, of course, what happened in 2019, we had that big measles outbreak, and most affected were Pacific. So, you know, it's one of these things around being in certain positions, understanding what we should be doing, but the resources sometimes, or decisions around where to mobilize resources, are controlled by others. There was also, some of you might recall, a typhoid outbreak among a small community, Pacific community, and perhaps on reflection, we can think that maybe our communications, our engagement with our Pacific families at that time could have been better. We've seen this in COVID as well, where sometimes the health system is not as responsive as it should be. And of course, I've done work in GP, which has been important in terms of understanding the challenges that some of our families have in accessing medicines, transport to get to doctor appointments. And as you know, I think it's in July, access to free prescriptions is being cancelled. And again, this will return us back into a space where access to medicines becomes another barrier due to cost. So one of the other things I wanted to talk about was the role that I carried in the Pacific, in the Cook Islands, when I returned to be the DG there. We went through health reforms, and sometimes I keep thinking, my whole career has been filled with health reforms, depending on which system I will move into. And it's been interesting. You get to understand the inefficiencies in the health sector across countries, across health systems, because health reforms are running and we forget about the learnings that we've had before. It's almost like sometimes people just want to have a clean slate and start all over again and learn the lessons all over again. And I suppose in the current settings that we have now, I'm hoping that it's already happening, where relationships have been disrupted and we need to reconnect and learn new partnerships, etc. But the inefficiencies are not good for our people. They make our ability to reach our people, it slows us down, and it does make it harder for us. But, you know, on the other hand, you can look, okay, we have to just work harder to make things better for our people. But I suppose the lessons I learned in the Cook Islands was really about looking after our whole country, reporting to a minister and cabinet, and understanding that the decisions we make at the Ministry of Health have to make sense, have to be efficient and effective, because we have less finances and resources to work with. But the other part was really working within the region with WHO, SPC, supporting us. And at the time, Sir Collin was at SPC as the big Director General there. So I think it's really about our connectedness, as much as this conversation that we're having today is about leadership and governance. It's really also about our ability to connect, our ability to use the relationships that we have forged in the past and bringing them into the spaces that we need them to be. One of the big things for us in the Cooks also was the 2020 COVID pandemic. And this really challenged our leadership, our governance structures in the Pacific, in the Cook Islands, and also pushed us to really tap into the resources that we could get from around the region, especially for smaller Pacific Island countries that have less access to these. And then I came back into the New Zealand health system and took up a role in the Waitemata district. So working in Te Whatuora space, in the hospital settings and community settings in the district health board days, and really pushing for Pacific health outcomes. And what I enjoyed from this was really the ability for us to stand up the Waitemata Pacific Community Leaders Forum. And this has been the best thing, and it still continues with monthly meetings in terms of reaching our people, and not only us sharing information with our communities, but also them giving us advice about how we could do things better. And we did this in the Cook Islands as well during COVID, and that's what made our community response quite efficient, and mobilizing our community to think about how we could protect our population against COVID. One of the other things I was also tasked with in the Waitemata for a brief period was helping establish clinical governance around the vaccination program. As many of us know, there was quite a bit of resistance from those that did not believe vaccination was the right thing. And it was important for us to get it right and do it right. And setting up that clinical governance committee with representatives from Pacific Māori, clinicians, immunologists, primary care, was really important to demonstrate our need to work together to do the right thing for our people. And I must say that was important in terms of making sure that we were able to justify or rationalize the actions that we were taking to protect the public. In my current role now in Manatū, Hauora, I'm the Chief Clinical Advisor, Pacific Health, and it's an interesting role in terms of the fact that you can provide as advice from your experiences, but the best advice is always that drawn from others, other leaders, those that have gone before you, those that are emerging, and we learn a lot. And for me right now, yes, I have a lot of history in terms of experiences, etc., but modern Pacific Health demands us to engage with our younger generation and understanding the drivers that actually make our work much more effective. And I suppose the take-home message for me over my work experience, my career in health, really has been the importance of leadership and governance. And I put here clinical specifically because, not because clinicians have all the answers, but because health is about clinical practice, but at the same time, understanding that you can have health managers, but if health managers don't have the clinical understanding of why things are required, then it makes it really difficult, because community development and community engagement is critical in all of these. But at the same time, when you match the two, it's great. But if you're lacking one of them, then it makes it really difficult. So for the same reason, I've got clinical leadership here and governance. You still need your community leadership and governance. And that comes from the NGOs, from the Health Promotion Forum, from in Aotearoa, from our community networks, understanding that we also need the ethnic specific workforce to be part of this. We need human resources, and I suppose for us in this current environment, it appears that we are having more resources allocated or assigned to Pacific Health, and I think this is an opportunity for us to take advantage of that, and see if we can continue to drive more of our people through. I can remember maybe some 20 years ago when there were just a few people, like at Auckland Public Health, myself, Dione, and a few others that were working in Auckland Public Health. Now we have a bigger workforce, young but keen to learn and with coming with different experiences. I've put a few others here. We understand the importance of having health financing and resilience as well, but also the primary care and public health area. Unfortunately, many health systems are hospital-centric, and the current government policy talks about us focusing on primary care and public health preventative arms. Let's see if that can eventuate, because the current structure does not necessarily reflect that. There's still a bigger investment if we look at the budget on the hospital. And so we just have to wait and see if we can see primary care and public health get more investment. Traditional medicine is something that we don't necessarily promote well in this country, in the region. It is growing, and I think this is one that we might have to think about in terms of our leadership. But the biggest one for us has always been about our community, and I put a question mark there, because even in the health reforms, we're talking about engaging with our community, and yet today, as we speak, just the Waitemata Community Leadership Forum is the only one that I know of right now that actually works. We have not stood up any others that I know of that are other than the Pacific providers, but it's going straight to the community. That's the one that really matters for me. And the other thing that we have to think about for the region, but even over here, is utilizing our diaspora, because this is an untapped workforce that could help us not just in the region, but here in New Zealand, and looking at where all our other leaders are internationally as well as here.
Can I just pause you there one moment, please, Aumea? We are experiencing some background noise, and I've just checked all our participants who have got all their mics muted, and I can't seem to source where this background noise is coming from. I just wanted to check if there might be some people behind you that we're picking up a conversation from.
I think so. There's someone next to me who's quiet now. I'll just finish that last slide.
Thank you.
Thank you. So, let us not forget our determinants of health. The commercial determinants are a big worry for us: big food, big alcohol, and big pharma. These are really important determinants that really make our life difficult as public health promotion workforce. So something for us to think about. We understand the social determinants. Housing is a big one for us in New Zealand especially. But I suppose with existential threats, we cannot forget the climate crisis that we are facing. And these are things that we didn't necessarily talk about when we were earlier in our careers, but it's here and now. The non-communicable disease epidemic is just nasty. We see it visually. It's all around us. Antimicrobial resistance, of course, something that we need to pay attention to. And I know we have an issue with this in the region already, which is a concern. given the access to less resources. But the other thing for us not to forget is the obesogenic environment we live in. We have a big problem in this country in particular, and it's being transferred also to the region. We know all the systemic and commercial determinants that make this happen. And so just thinking about us, we're talking about leadership and governance and the importance of it, but we've got big challenges ahead of us. We've got big learnings. We've got many experts, Sir Collin, Sione, and others who know the solutions around what we can do, but it's really making sure we as a people, we as a collective can do something about it in the near future. Thank you very much for this opportunity. Kia rana e kia manuia.
Thank you very much, Aumea, for sharing those important aspects of our journey in health and leadership. And you reminded us of we stand on the shoulders of giants before us who paved the pathway with their sacrifice in the recent past and beyond that. And the important work that you're currently co-leading in the ministry, and you remind us that we cast our vision wider than Aotearoa. It's about the region and to utilize more diaspora. And of course, you're sharing your own professional and leadership journey. Certainly, the participants are motivated and inspired by your talk. And there will be more questions to you later on. But last and not least, our final speaker, Fiungalu Tevita Punaki. Tevita is currently the CEO of the Fonua Trust, and he was the CEO since 2010. And prior to his tenure with the Fonua, Tevita held prominent roles, including Pacific Health Manager for ProCare Health Limited, and he was also in the education sector at the tertiary level as the National Pacifica Liaison Advisor for Massey University. In addition to these roles, Tevita was also, and still is, very actively contributing to Pacific health and Pacific education in many spaces. Advisory roles included in health, education, and the social development sectors. Like say Collin and Dr. Herman, Tevita is a wonderful colleague, and he's one of our leaders today. And Tevita is going to share his leadership experience with us in the next 15 minutes or so before we have our round of questions. The floor is yours, Tevita. Thank you.
Koribe moke wa malumalo atu tau whataputu mo whenga maari koni. Maro ele lei ni sambula vinaka kirana tatukato toa. Valo rayat motolos. And warm greetings. Again, thank you for the opportunity. And I'm not sure whether I have a harder task than you, Aumea, following Sir Collin and yourself coming in to share about this my leadership journey in here. I thought that the topic, Sione, was quite interesting in terms of the word tufunga. It's about, when I think about tufunga, it's not just building, it's carefully constructing things for well-being. And it's about effectiveness and how do we drive effectiveness on the things that we actually do. What I thought today is just to steal some practical examples of what are some of the lessons that we've learned during the recent COVID and also the recent weather events that demonstrate some of the required leadership to be able to drive what actually matters and what drives and underpins them. First and foremost, I'm Tongan. I'm one of the very lucky Tongans that it's controlled by a Samoan woman, and we are blessed with four children. So we navigate in a world of a mix cultures for our children as they see themselves as half Tongan, half Samoans, and full Kiwi. And I think one of the things that kind of set aside in terms of our continuously to be some of the challenges is how we actually address Pacific, especially when the large majority of our Pacific in New Zealand are born here, the number of mixed ethnicities, and also that New Zealand's Aotearoa is their home. Their normality is actually in here. But for me, personally, I think in terms of some guiding principles, I think I'd say very similar to Sir Collin around that the guiding stars for the way I navigate things are fundamentally based on the core values that I have, which have been developed over the years that are closely linked to my cultural values, to the Tongan culture, the way I was brought up at home, in the village, and in my family. And similarly, I'm also, within the church community is also the Catholicism stuff. And when you talk about Catholicism as a younger age, one of the things that I did with my grandfather was being the leading of the St. Vincent de Paul services. So that kind of underpins around the support of the needy, driving better social justice for some of our families, and also being, addressing the fairness in there. So those values are quite similar, and that has been what have guided me, and been fortunate to work for an organizations that kind of share the same values around leading from the front, leading with the team, leading with integrity, with respect, caring for others, and so forth in there. So, Colin's touched in terms of the servant leadership. It's very clear as a young age, the pathway to leadership is through service in there. And it's about thinking about what is the best for others and utilizing the platform and the skills that you have to be able to influence that. I think being able to adapt to the different situations has been really helpful, and underpins by having some courage to be able to voice what is important for your community, for your family, and for beneficiaries of the people that you're working with. So a mixture of being driven through service underpins by values, being able to adapt to different situations, and being able to be, demonstrate some courage. It often is a Pacific leaders, you often sometimes at forums where you are the single voice that represents the interests of your constituents and your community, and being able to articulate and have the courage to push this through. My mom taught me that the blessings for doing good things through leadership is to do some more good things. And it's about, doing the right things, and having the ability and the support systems to be able to do that indeed. So I think there's some of the probably is my leadership journey. Those are more the guiding principles that informs or set the way I behave and lead to the. But let me borrow some learning from the recent COVID stuff, and if I can, I'll just do a quickly sharing some slide, and happy to share this slide. Okay. So firstly, I think one of the critical things in the last few years that we've learned through COVID was actually around the workforce, was around driving the trusted partnership, and the approach around for Pacific was around the ethnic specific. What we've also learned through, the health literacy, being able to navigate the system continues to be still a challenge for us as a community. So the first thing is around the Pacific workforce. I think the limitations that we have in terms of Pacific availability of Pacific workforce was a huge challenge. So I think as a leader was about how do we, what is the things that you need to do to be able to capitalize on their very limited workforce. What I've learned coming into the health sector, I'm an accountant by trade. So my foundation background is more in the corporate financing and investments, and I understand as earlier on in terms of my career and development was about maximizing the returns for my shareholders in their similar principles around coming into this space. It's about how do I maximize the health outcome, the Pacific prosperity outcomes for the beneficiaries of who I work for and my community. So Pacific workforce, though, is actually very limited. I've also learned that our superpower is actually our Pacific, is our frontline staff. Often when I get out to communities, to churches and so forth, the names that are coming up is not my managers or my directors, but often it's the name of the doctors and the nurses. It's the health promoters, the social workers, and those are the ones that actually matters to our families in that. So it's about, we've learned quickly around how do I power up our frontline staff and then work across the different systems to be able to access some more specific stuff, whether it's at the district health board at the time or other organization, whether it's ARBS or the Pacific providers to work through, and then the partnership working with Aumea and the team help us to actually look at bringing in more Pacific. We've also looked at the Pacific in terms of what are their key roles around leading and having the non-Pacific skill sets to be able to support some of the other stuff. So the Pacific workforce was actually critical to us. What we also learned is that the cultural competency stuff was actually really important. The ability to communicate in the first language often was very helpful. And being able to understand the cultural context within families was also quite important as well. So having those Pacific staff, they'd be able to communicate in their mother tongue and all that, we try and actually capitalize on that. Because my frontline was actually really important, it's about the staff well-being and they're making sure that they've been looked after, culturally, spiritually, and physically, as well, and also mentally. So part of the support was around for those well-being support for staff, and whether it's getting them feed or starting over for Lotu. What we also done through this was around the importance of continuous learning. So the stand up in the morning and the evening is the ability for us to capture what did we do well today and what was our stuff up in order for us to do better the next day. And the other thing was around the support for well-being as a leader, was being able to communicate with my team. So on a daily basis, there was a check-in for myself and a check-in from one of the staff. And this is relatively a quick example so that they were going out on a daily basis. Part of that was actually providing the motivations and care for our team in there. The other key things was around partnership. And I think leading through was around it takes a village to raise the child. It's about you, who are the partners that will help drive the things that you do. So better partnership around with patients and their families and driving the relationship with them, to partnership with our community leaders, being able to work with not only just our community leaders, but our church leaders at the different ethnicities. And having the cultural context to be able to engage and drive it. And most of the solutioning actually came from a lot of these forum and those leaders working closely with us. The other core relationship was around our sector relationship. The people within the system across the governments to be able to provide the support and the resources to work with you, and whether it's the health space or the social space or the place, but those were some key partnerships. So in terms of partnership stuff, was first and foremost was around patients and families, was around our community and church leaders, and Aumea touch in terms of setting up that wonderful forum of bringing our leaders together. out of the Waitemata space, and working, there has been provided a platform to provide the insights and guidance from those. And then the wider, we work with who are the key people that we work with, whether it's actually government or partners or philanthropies. That was important. The other key thing is specific leadership during a challenging time was moving into more specific, ethnic-specific approach in there. And part of it was, again, partnership with our leaders for their guidance, but also working to increase the low coverage of COVID vaccinations at the time in testing. For Pacific was working closely in a different ethnic group. And I think we've learned around Pacific is not one group. It's a collective of different islands and different cultures and different language. So being able to drive a ethnic specific approach have worked well during this challenging times. The locations was important for us. Our sites across the region was familiar locations that people could come into in there, and our communities and families were used to know where we are in there. But even when we set up, a bigger vaccination areas, was about the designing it to have the feel and the look and the understanding our families, coming to get a jab. It's not easy, but setting up the environment that, enhance their, feeling coming into their, whether it's a specific space, the specific languages, the specific music and all that. Has been quite important. We also learned that some of this will not be enough in terms of some of the hard to reach people. So the pop-up areas was again in consultations with our communities, and some of the physical locations, again, using whether it's church communities or facilities, or even going into familiar locations within the community. The hard to reach folks are the ones that are home-based. So being able to deliver a service not only at the communal level, at a clinical base, but also the home-based services. And being able to stand up a team safely to be able to understand this. What we find in there was, these are the hard to reach folks, often on their own. And being able to engage them not only with whatever services, but being able to connect wider. The data and messaging awareness was also critical. Being able to get access to as good data as we can get to within the system, whether it's through apps or through the DHP, help us in terms of being able to plan our approach and targeted the service delivery that we have in there. So even getting to a level 3 detailed data of where ethnic group breakdown, where do they live, help us inform that. The messaging, utilizing, there was the fast-paced changes of the guidelines in there, being able to use different media systems, whether it's social media or through website, being able to share a more accurate, up-to-date data at the different vernaculars have been really helpful. Even jumping on some of the mainstream media at the time in there. And saying that the messaging is important is not only first and foremost to our families and our communities, but what I've realized is the lack of good informations from the frontline grassroots community base at the center. And they're talking about the Wellington space. How do you be able to capture that to be able to inform at the different funding or policy tables that we were sitting, that are sitting on, whether it's MSD or Rangatamariki or police or health at the time. So having good information, good insights from the grassroots has been really helpful. What we also drove through this is the confirmation to the approach around support for families in a holistic way has been really useful. And it doesn't matter which door that they come into, we'll look at a more holistic support for them. And, we touched on earlier speakers around the seriousness of raising health profile or dialing up health gain for Pacific. It's about the wider issues and the wider determinants, whether it's social or commercial, economic determinants in there. So the ability during this challenging time to be able to provide a more holistic support for families. While you get a vaccination, you'll get a car if you need it. If you have some mental health distress, we'll be able to link you up with those support for you and your families in there. So a model of care is fundamentally important, and the leadership requires around there was important because often the funding are siloed from different agencies and they've asked for specific things in there. So model of care was the ability for us to deliver an integrated services, which our families actually wanted in there. I think the last part was around the infrastructure, and we touched in terms of if we learn from the past, we'll probably do things differently. And when I look at some of the old documentations within the funnel around the SARS stuff, infectious control management workforce, organizational preparedness, we're all in there. And yet I think we kind of, when we came into the COVID period and the weather events, we kind of didn't learn from there in there. So we wanted to make sure that we are participating there. And one of them was actually looking at our infrastructure and development. The first part was around none of our facilities was pandemic proof. Couldn't manage the infectious control carefully. Sending my team into the facilities were probably far more riskier than actually working outside in there. So setting up sheds in there to be able to resolve the facility during the time when we came out of there, the ability for us to provide some investment in terms of improving our facilities so that we can COVID free. What I can say that most of all our facilities now in our clinical space, you could zone that into red, orange, or a green zone. Should there be another pandemic, which we think will be another one in there. This is our Henderson thing. It's while we are across Auckland, West is always a home for us. And, these are one of the facilities that we've upgraded during the post-COVID in there. Last year around, I think some of the key things that we've driven through this challenging time is our biggest concern, my biggest concern in the team here, what is the downstream impact of the COVID period and also our weather events. Our kids were not at school, 37 Pacific didn't attend, only attend regular at schools. We saw the employment displacements of our families. We saw the increase in the level of distress and distress and also the domestic violence space. We saw the drop in terms of our immunization coverage and so there. So part of the things that we did in here was actually a reset in there. Where we landed with were 4 big goals. Being a data-driven, so the data that's actually important. What research that we need to participate on to be able to provide evidence in guiding of policy setting for the future. Our model of care that I've touched on continues to be an important part. Our superpower is around our workforce, where we focus on empowerment in there. And the last one was around redefining access in there. Our people are now accessing services differently, face-to-face, virtually, or telephony-based in there. Our vision is still the same of being well, a safe and vibrant and informed community. And the underpinning values are, four big values of reliable, respect and integrity and whānau relationship. And we've asked the questions of being whānau-centered or patient-centered. So when we talk about reliable, it's about us staying true to our words. When we talk about respect, that we treat people respectfully. Integrity, that our consumers, patients and families feel that we are open, honest and safe. And relationship is about caring for my family and community. So those underpinning values set the tone and the culture. And I'm not saying that we're perfect in there, but it's about driving that. And when we get lost, these are the pillars that kind of guide us back into it. So it's about focus on addressing the equity, and it's a well-being focus on families rather than individuals in there. So this is kind of like the part of taking on the learnings of looking back during COVID, looking at the environmental stuff and the challenges, the voices of our patients and families, the voices from our the community leaders, the voice piece from our staff to be able to reset our strategy going forward for the next few years based on those key learnings in there. And again, we have, I think, a similar thing. I think the timing of response was important, having the capacity to respond to disasters were some of the things that we've kind of delivered through the whole emergency, setting up, whether it's a food support or food security or setting up a clinical team that we've learned through in terms of the COVID, especially our at-risk patients and families that have not access to medications. So setting those up in a timely fashion was actually really important. Again, part of it was actually partnership with our key partners, community leaders, organizations that help us on delivering the support services for those people that actually need it there. That's probably for me. So I think in summary, folks, it's what driven as a leader, as around based on our values, on my values, that's been informed by community, my church and my family, being able to culturally anchored, the ability to lead through service, and the courage to be adaptable at times in different situations. And, it takes a village to raise a child, and part of it is actually take our whole teams to actually affect some of the things that we try to lead. We've got to be more impactful, first and foremost, in our families and patients and groups, and in which platform that you could actually influence the policy level that drives some of the focus and funding to support Pacific. Thank you, Senator Mala.
Thank you very much, Tevita. Your comprehensive presentation has really illustrated to us very clearly how leadership can be translated down the line to inform all aspects of the whole operation. And you highlight the importance of connecting and reflecting and addressing the needs and the aspirations of our communities, our clients, our patients that we work with. And it sounds familiar, as you said, your dear mother said that the reward for good work is to do more and keep it up. And thank you again for your presentation. Lots of lessons there to learn overall from your 3 presentations. I have a few questions, but I will not start with that. I think already we have 1 or 2 questions, and I would like to invite Mariana. Mariana, you're the one who is going to ask the questions today, and on behalf of the participants. And please keep the questions coming. We have some 20 minutes before we finish. We started a bit late by 6 minutes, so 20 minutes before we wrap up. Thank you. Go ahead, Mariana.
Thank you, Sunil. So yeah, we do have a couple of questions. The first one I'm going to ask you is on behalf of Nita Mate from Nelson. And this is to any of our experts, including yourself, Sunil. And the question is, are there positive spin-offs from the relationships between community and services that you didn't have before COVID? One more time?
One more time, please.
Yeah. So that question again, are there positive spin-offs from the relationships between community and services that you didn't have before COVID?
So, David, you have a go first, and then Aumea, because both of you touch on COVID and with your experience, and then, say Collin last.
Yeah, definitely. I think there are really strong spin-offs in there. What we've learned during the COVID period is that with, as a community-owned organizations in there, we had some good networks into the communities. But those networks were actually much, much wider. It was widened during the COVID stuff, and especially into our smaller minority ethnic group, the Kiribati community, the Nauruans, smaller nations have kind of built those relationships in there. What we also see that in the first COVID ones, as we called it, when we look at access to services, 65% of the people that were accessing food for us were actually not in any of our services across the region. So there were some challenges around this. So working closely with those community leaders have been really helpful, and it continues to be. What we find in terms of community mobilizations, they were actually quite critical. What we also find in terms of approaching to their different segments of the community, whether there's the youth component as a challenge and all that, has been really, really useful. But it's about, it's the VAR, it is about mutual benefit, in maintaining this. So there's no doubt around that our network with our community has been widened, and some more insight in terms of how they can help with developing the solution and the approach for their own respective community. Malo.
Thank you, David. Aumea?
The answer is absolutely yes. I was actually in the Cook Islands when COVID arrived. And the thing is, the year before COVID arrived, we were actually setting up community groups, advisory groups, and connecting. And when COVID arrived, it was just already in place. And so we just needed to tap into that. But yes, as Tevita said, the expansion into other spaces and other groups was quite important. I think for me, I'm more concerned that all the good stuff we picked up during COVID, where we had to mobilize our people, is sort of, people seem to have short-term memory. We need to be able to sustain that, because without the people, we'll be talking to our health officials all the time, and where's the learning in that, and where's the improvement in quality, etc., when we don't have the people there. So I do think in New Zealand we could do better in terms of engaging the community and having those authentic relationships where we actually listen. Yeah, that's really my only concern right now, is that all those relationships we forged and strengthened, they don't appear to be holding at the moment in many areas. Thank you.
Thank you, Aumea. Say, Collin?
Oh, I was one of the guests at a panel in Wellington last week talking about the budget. And I keep referring to the fact that if you rely on conventional delivery, in other words, if you always do what you always did, you'll always get what you always got. And I highlighted the fact that with the COVID-19 vaccination rollout, it was very sluggish for us in the beginning, very slow and so on. And I referred to the fact that the change happened when the Tongans started the trend of drive-ins. I remember the first one at Whavona, the Tongan church in Te Vito was a key player in this. And it set a trend. So the Niueans had theirs mainly at the Mormon church the Cook Islanders, etc. And whilst there was a slow start, the uptake for dose 1 and 2 among the Pacific communities was some of the best in the country. It took a while, very slow. In other words, if you stayed with the conventional approach, we wouldn't have got what we got. So those relationships are not new, but what was new was that it was put to good effect. And I use the COVID-19 vaccination rollout as a very tangible example of the impact that we had by using those relationships well, I thought. Haven't had anyone disagree with me, but that's my assessment of it. So perhaps not new relationships, but those existing relationships were put to good effect. In other words, if you just simply relied, there was a big mass vaccination thing at the Telstra Centre, whatever it's called these days. And I said at the time, I didn't think this was the right approach, but they were all saying, oh, yes, they would. In the end, the mass vaccination event at Dewdrop Centre, I think it's called now, not over, but it had really good uptake by Asians and Palangi New Zealanders, but there were barely 1,000 Māori, barely 1,000 Pacific folk went through that centre. In other words, we knew it was going to happen. We suggested that this was not the right approach, but it's like, what do you guys know? We got this, and lo and behold, I think we were right. In other words, you cannot rely on conventional delivery. You have to listen to and use Pacific communities, Pacific leaders, Pacific providers.
Thank you, Collin. And if I may add on to that, I put on my interfaith leadership network hat to work with Devita at the Fono, as well as the leadership of Langimari Health Clinic and other Tongan community groups. And we put together that first big vaccination drive at the Free Western Church complex on Hauora Road. And as you rightly said, Collin, the mainstream approach did not work, the one at Telstra Clear Centre. But it's about, as all three of you said, it's about working with the communities and listening to their needs and aspiration and their wisdom. And it's about collective leadership. But I think it's a good reflection from Aumea there, that we need to make sure that we have long memories, not short ones. The lessons, from the COVID, we need to reflect and learn from that. Mariana, are there any more questions?
Well, you kind of just answered the last question from the audience, and it was from Monica. And the question was, what are your thoughts around mass vaccinations and its impact on the long-term outcomes for Pacific? Do you want to extend on that?
I'll put it to the speakers.
Johnny, can I just say it's unfortunate because we should have learned, or we ought to have learned. This is not new or rocket science. In other words, we knew already before COVID that this was going to happen. Some years back, we designed and delivered the meningococcal B vaccination program. And we had fantastic uptake of the meningococcal B vaccine. And the public health threat was diminished because it had excellent uptake by Pacific families and young people. And we used our communities, we used our leaders, we used our sports people, we used our comedians. In other words, it was a total community effort. why didn't we learn from that and had anticipated that for COVID? In other words, we didn't have to go through that whole process again. And this is what I mean by, if we don't learn from history, we're bound to repeat it.
Thank you, Collin. If there are no more questions from our participants, let me just give...
Could I just add?
Oh, sorry, Aumea. Go ahead, please.
Really to that question around the mass vaccination, I think what it's done is, apart from the demonstration of the ability of the Pacific community to mobilize, it's also held many of our people in good stead. As you know, even though COVID is still hanging around, many of us, not many of us are in hospital anymore. And that was the main purpose of that particular vaccine. But coming back to today, we don't learn well. Besides the meningococcal vaccine campaign, there was the hepatitis B one, where we wanted to sort of get an assessment of how many, what was the carriage rate. As we know, some of our Pacific populations have high hepatitis B carriage. And right now we have a pertussis outbreak in the Auckland region. We are sitting, waiting and anticipating a measles outbreak. And yet no one seems to be talking about thinking that should we just do a community vaccination? What you hear, and I heard this when I was in the middle of the mumps outbreak, was, oh, it's going to cost us a lot of money. It costs us more money when our kids get sick and people get sick in hospital. So I think whether it's the reform process that's in place, whether there's, I don't know how to describe it. People just, even our own Pacific Health workforce, just, those that are in positions that can actually activate this whole process to rally our people to get vaccinated. There's an apathy, in my view, of something that we know works, and hard to explain. I do think the lack of clinical leadership and governance is a big issue, and probably has something to do with what's happening with our Pacific sector today. So yeah, just some of those things to think about. Thanks.
Thank you, Aumea. Actually, that's... Oh, Tevita, please.
Quickly, Sandy, very quickly. I think one of the things, I think the mass vaccinations works. I think one of the things that we need to improve on is firstly acknowledging the role that our community leaders are actually playing. From a system view, often these through voluntary work got most of the time in there, and how do we recognize that formally? The second thing is, what are the supports? Because our village still bases on sports clubs or bases on church facilities, and there is how can we improve the data and infrastructure of some of those settings that will help us in the future. And thank you, Club.
Yeah, thank you, Tevita. If I may ask a final question, but there's one there that just popped up on the... Brianna, there's a question there on the chat, I think.
I can't see it.
Right.
Oh, this. Sorry, it's from May. So May would like to know how much... I know that people do not like to talk about money. I would like to know how much it costs the country when there are hospitalizations and illnesses. How is it quantified? From May.
It's not...
Thank you, Mariana. And Collin.
Sorry if I could make a start, Sion. Excellent question, but it's not easy to do, because you'd have to work out who's hospitalized and for what reason and for how long. And in the public hospital system, we don't actually have a value on what it costs to put the average person in a hospital bed. I know we know broadly, but it's not readily available. I do know that the cost of intensive care is reasonably well constructed in New Zealand. So it's doable, May, but it's not something that's readily available. I think we can safely say, clearly, it's cheaper to prevent than to cure, but I'm not aware of any of the kind of reliable estimates of hospital care. So people talk about it costs more than, this is probably old now, but it costs more than $2,000 a day to have someone in intensive care in a New Zealand hospital. That's one day, one person.
Thank you, Collin. To wrap this up, I'd like to put it back to you again, speakers. Some final words of wisdom from you, perhaps where we can improve our collective leadership, or what are some of the issues, as Aumea pointed out, the need to have more representation, clinical leadership representations at the governance level, and workforce development that Devita touched on. Any final thoughts from you all? Let's start with Devita Funagi, the last speaker, and then Aumea, and then Collin, please.
I think just in addition, Sione, to my sharing in there, I think as a leader, it's not to try and, you can't solve all the problems on your own. It's about you surrounding yourself with good people, with good team and good network to be able to effect those leadership decisions or impact that you actually have. And lastly is coming into health. I've learned pretty quickly in health, and I struggled in managing doctors until I asked one of my family that happens to be a doctor and says, why are these doctors don't listen to me as the boss here? They say, sometimes, Tevita, a doctor will only listen to a doctor. So don't pretend that you're clinicians. You leave it to the clinical people and the clinical leadership. So there was a really good learning area of the person there is, while you have the skill sets that you have, is actually utilize and trust the people around you to support.
Yeah, thank you, Devita. Aumea?
I think we should sack those doctors that don't listen to you, Devita. I have a very high respect for non-Pacific clinicians, leaders, because I've learned as much about health from them as I have from the community. In fact, you can get a medical training experience, but it doesn't teach you about life. And to look after our people, you need to know a bit more about how you maneuver our people, how you look after, how you're compassionate and kind. And that does not come from medical training, in my view. I think if we can remember that we live in a country that has a lot of resources and opportunities, there's many ways to skin a cat. I never like to say that one, but there's many ways to achieve good Pacific health outcomes. And we need to think strategically about how we use all our connections, how we look at Sir Collin sitting in a position where his voice is listened to, and sitting at the university where research also informs our practice, where Tevita runs one of the best outfits in Pacific Health in West Auckland and across Auckland. And I'm sure he'll be thinking about taking over New Zealand soon, Tevita. But yeah, we just have to, I don't know, it's having the humility to work with others that are like-minded and always there for the people. I think that's what good leadership is. And governance is about making sure that we try our best, diplomatically or not, to get the most resources our people can get to make our lives better. Thank you.
Thank you, Aumea. Sir Collin.
Well, the irony is that there's more of us now in the sector, more voices, more Pacific people at different levels, which is a wonderful thing. But the downside is that leadership is more diffuse, meaning at a time when there were a few of us, perhaps it was a lot easier to identify the locus of leadership and to have those people speak with some confidence about what our communities might need. But of course, with the expanding sector, as I say, it's a good thing. But one of the downside of that is the leadership, locus of leadership has become more diffuse, and people are reluctant to speak up or speak out. Not that it's bothered me in any way at all. I've kind of spoken out every time I see something that I disagree with. So I'm not really worried too much about what people might say. I do so because I think it's the right thing to do at the right time. So as I say, it might just be, Sione, that as the sector expands and there are more people involved, we've become less confident about speaking up and speaking out at a time, I think, when we should be speaking up and speaking out. The political environment at the moment, it's not great for public health or Pacific health. You just have to look at the budget. There was nothing there to support Pacific providers, even though we've spoken this morning about how effective a Pacific-led, community-led initiative is and can be. The Ministry for Pacific People had a cut, is my understanding. In other words, the current political environment is not particularly friendly towards us, which to me means we should be speaking up. But as I say, I understand people are reluctant to speak up. I've never had that problem. I think my problem is knowing when to shut up.
Thank you, Sir Collin, for that final observation. It's a challenge that has been ongoing, but more so, as you said today, and that's an important final food for thought for us to mull and to ponder on as we leave this space. But in a minute, I will ask on behalf of my team to open up your camera so we can take a group photo. But on behalf of all of us participants and our team here at Health Promotion Forum, would like to express our deep gratitude to Sir Collin Tukuitonga, Dr. Aumea Herman, and to Fiungalo Tevita Fonaki for the gems of deep wisdom that you have shared in your exemplary leadership journey in the health and other sectors on behalf of our community. And thank you again for the opportunity to come and share.